Hello, my name's Jesus. We're going to do this assessment really quick. We're going to go over some information, what we normally check on the baby. Let's start up. Normal vital signs in a baby, heart rate would be 110 to 160. Respiration would be 40 to 60. Blood pressure would be 65, 85, systolic, and 45 to 55 diastolic. Temperature usually cannot be lower than 36.2 Celsius and can't be any higher than 37.7 Celsius. When they're sleeping, their vitals are usually going to be a bit slower and lower. When they're crying, their vitals are going to go a little bit higher. They're going to bump up a little bit. You're going to notice everything just go up a bit. You got to identify on a newborn syndactylity, polydactylity, and semi-increase. Syndactylity is the webbed fingers. See the fingers on this baby? They're not webbed. Well, they kind of are, so he would have syndactylity because you see how they don't come apart. That'd be webbed fingers. The toes would also have the polydactylity, which is polydactylity only affects the toes of the feet. And a simian would be a deep straight line across the palm, and it's typical in babies with Down syndrome. APGAR are the 5 signs that are measured in a newborn when they're birthed and 1 minute in. Heart rates are checked, respiration's checked, muscle tone is checked, reflexes, and color. The score should be obtained 1 minute after birth, like I mentioned earlier, and then again after 5 minutes. Check again after 5 minutes. A score of 8 to 10 requires no action other than the continued observation of that infant. Usually, if they're below 3, that requires immediate interventions. They're usually transferred to a specialist unit, and they go from there. We'll start with acrocyanosis, the bluish color of the hands and the feet. It is normal. It's just caused by low sluggish circulation, and it should go away in a few hours. Fontanelles, you want to check the shape, and you want to know when normally they would close. Normally they close around 12 to 18 months in the anterior fontanelles. The posterior fontanelle usually closes after about 2 months, and it is triangular shaped, and the anterior fontanelle is diamond shaped. If they're sunken, it may indicate dehydration and should be reported immediately. If it's bulging, it means there's been increased intracranial pressure. Stork bites, they're flat red areas seen on the nape of the neck and on the eyelids, and they result from the dilation of small vessels. Strawberry hemangioma, flat, but stop.
What?
These lesions are usually red, bright red, they're elevated, and they usually disappear by 5 years of age, and 90% of them disappear by 9 years of age.
Stop!
Port wine is a red-purple lesion. It doesn't blanch with pressure and is a permanent skin marking. It darkens with age, and when injured can become elevated. Usually it's a large area of the face or neck, and usually laser surgery may be required to remove it, and it's usually done to preserve the self-image of the child, and can be associated with genetic disorders. Mongolian spots are bluish discolorations of the skin, and they're common in infants of African American descent, Native American descent, and Mediterranean descent. They're usually found over the sacral and gluteal areas. They disappear spontaneously in the early stages of life. Harlequin sign. It is the deep red color over the body. It's usually over half the body, and it occurs in preterm infants who are placed on their side. and it usually disappears with muscular activity. Changing the position of the infant is usually very helpful. The condition is temporary and usually does not indicate a problem. Vernix, it is a protective, cheese-like, whitish substance made up of sebum and dead epithelial cells that's present on the skin of a newborn. The milia, they're pearly white pinpoint pupils usually on the face and nose of the newborn. Treatment isn't required.
Go.
No treatment is required. It's important to tell the parents this. Make sure they don't touch it, they don't rub it. It'll go away naturally. And again, make it clear to the parents that they shouldn't try to squeeze it out because infection can occur. Epstein pearls are pearly white pinpoints in the midline or upper abdomen, and they go away as well. Witch's milk and breast engorgement occurs usually in the breast of a newborn baby, and is temporary. It occurs because of the mother's hormones that are present in the placenta during pregnancy. Breast engorgement in the mother is not going to happen in the infant as much. It just happens to get the milk flow started, and it helps soften the areola, and it's just a process. The umbilical cord should have the vessels that carry the oxygenated blood. This one doesn't have one present, unfortunately. There's two arteries here. One carries blood away from the fetus, and one vein returns blood to the fetus. Wharton's jelly covers and cushions the cord vessels and keeps the three vessels separated. The difference between caput, succedatum, and cephalomatoma is that caput succedatum is a swelling or edema of the newborn scalp that can cross the suture lines, and usually simply called a caput. It is self-limiting and doesn't need treatment. Cephalohematoma is a collection of blood beneath the cranial bone and is seen on one or both sides of the heads, but does not cross the suture line. And it usually recedes within a few weeks without treatment. Molding, that's the shape of the head, the shape of the head that it takes during birthing. Might be a little bit elongated. No reason to be concerned. It'll usually go away after a couple weeks. Some reflexes you want to check are the gag. It's caused when you touch the back of the throat, by any object touching the back of the throat or the roof of the mouth. Sucking, usually you can touch the lips and the baby will do a sucking motion. Rooting is when you stroke or touch the side of the baby's mouth, and the baby will turn its head and open its mouth, trying to follow and root in the direction of the stroking. Babinski is the sole of the foot, which is firmly stroked, and the big toe goes back toward the top of the foot, and the other toes fan out. It's a normal reflex up to 2 years of age. Tonic neck is when the head is turned to one side, and the arm that stretches the opposite bends up at the elbow. Unfortunately, this particular dummy doesn't flex. So I can't show that, but this is often called the fencing position, and the tonic neck reflex will last to around 6 months of age. Moro is called the startle reflex. He can't hop. But it's usually when a baby is startled by a loud sound or movement. How do you spot respiratory distress in newborns? Usually it's by persistent cyanosis. You want to check for blue hands or feet, grunting respirations. It's a noise you can hear without a stethoscope as the infant exhales. You flaring of the nostrils, retraction of the sternum or between the ribs, or a sustained rate of 60 breaths per minute or higher, sustained heart rate of 160 beats per minute, or less than 110 beats per minute. Hip clicks and gluteal folds. Hip clicks are an audible click or pop that occur in the hips when being examined. If you hear a hip click, they should be monitored for hip dysplasia. Gluteal folds are a crease separating the buttocks from the thigh. Surfactant is a secretion of the alveoli and air passages that reduce surface tension and contribute to the expansion of the lungs. There's three shunts that exist in uterine life. The ductus venosus diverts blood away from the liver as it returns from the placenta. The foramen ovale diverts blood from the right atrium directly into the left atrium rather than circulating it into the lungs. Ductus arteriosus diverts blood from the pulmonary artery into the aorta. Fetal shunts are not needed after birth. So after the infant breathes and blood circulates into the lungs, the foramen ovale closes because pressure on the right side of the heart falls as the lungs become fully inflated and there's little resistance to blood flow. As the infant blood oxygen levels rises, this causes the ductus arteriosus to constrict. The ductus venosus closes when the flow from the umbilical cord stops. There are 4 methods of heat loss that you can prevent. Evaporation would be one. Conduction, convection, and radiation.
Go.
Okay, so during your physical assessment, you want to know the color of the baby. The color will usually be pink. If they're pale, mottled, or showing signs of cyanosis or jaundice, interventions need to be taken. You want to check the fontanelles, suture lines, the head. You want to make sure the fontanelles are soft, flat. If they're bulging or depressed, you want to follow up on that. You want to make sure everything's okay. The ears and eyes, you want to make sure they open, that they're clear, equal, lateral. The nose and the mouth, you want to make sure they're open. Everything looks okay. They're pink. The pulse, you want to check your pulses. Usually their heart rate. No pulse. Stop.
Okay.
The normal values for these vital signs stated at the beginning of the video. Heart rate for baby would be 110 to 160. We want to check the pulses, the respiratory pulses should be around 40 to 60. No, stop.
Yeah.
Pulses are 110 to 160. Respiratory, the respirations will be usually 40 to 60. Again, this was covered in the beginning of the video. I'm not going to mention it again. You want to check for effort on breathing. You want to make sure they're breathing okay without, you want to make sure they're not flaring their nostrils, they're not having difficulty breathing. You want to make sure their breath sounds are clear and equal. There's no rales. You want to make sure their heart rate is regular. You don't want any murmurs. You don't want an irregular heartbeat. Their abdomen, you want to make sure it's soft, round. You want to listen for bowel sounds. Make sure it's not distended or tense. Reflexes, you're going to want to check all the reflexes that were mentioned before. Their skin, again, you're going to just want to check, make sure everything's okay. Pink, not too much cyanosis. That'll usually go away after a little while, a few hours. You want to make sure genitalia is present, nothing's wrong there. Not too inflamed. You want to make sure they're awake, awake or active or asleep. You want to make sure that baby's okay, it's crying okay, no high-pitched screams. You just want to check all the extremities, make sure all the joints are present, all the reflexes are present. And you want to make sure you do a Ballard scale, which checks gestational maturity, which consists of checking for posture. Depending on how the baby lays, they'll have different scores. You want to make sure they can do the so-called square window, which is the way they can hold their wrists Make sure it can go 90, 60, 45, how far they can go, or 0 degrees. Same thing with arm recoil. You want to make sure their arms bounce back. You want to check a popliteal angle. Make sure you can bend their legs back. Unfortunately, this one cannot bend too much. You want to check their scarf signs. Again, this you can't show this with this dummy. You want to do the heel to ear. Again, this one is unfortunately not too mobile. And that should be it for this video.